Hello, I'm Seun Sowemimo, your friendly bariatric surgeon. I started out in a family where my dad was a surgeon, or is a surgeon. He's a plastic surgeon, and my mom an accountant. So there was always that early pressure to become a physician, which I resisted for a while until finally I gave in. Initially, I thought I would do something that gave, credence to my artistic leanings. In any case, after going to medical school in Lagos, Nigeria, I felt I wanted to get out of my father's shadow, who was actually the provost of the medical college that I attended. So I ended up going to England for the medical studies or residency. And at the time, I was still thinking of becoming a plastic surgeon. So I started training at the Royal College of Surgeons, doing general surgery and doing plastic surgery. But at the time, what grabbed my attention was the impact of technology in medicine. And in surgery in particular, I found this to be fascinating, the way that laparoscopic surgery was catching on. How it could be that you would do very complicated surgeries through very small incisions. And there was no other place where I found this impact to be greater than with bariatric surgery. So while I was training, I decided to move over to the United States and was at Columbia University at Harlem Hospital Center. I developed a passion for laparoscopic surgery and decided to go on and do a fellowship in laparoscopic surgery. It was just fascinating to me, the impact that this surgery had. These were huge surgeries, excuse the pun, that was being done through very small, tiny incisions with minimal impact to the patient. And I thought that was a really big deal. My practice philosophy, from the time that I, interacted even with my father doing surgery, and the first surgery that I actually assisted him in, and the only surgery, I almost passed out, but what I left that with was the impact or the rapport he had with his patients. I saw how, he really cared about the patients as persons, not just cases, and the way that they showed appreciation to him. I remember walking with my dad doing rounds on like Christmas Day and things like that, delivering wine and gifts to nurses on the floors where he worked, and how people appreciated what he did, and not only the patients but also the staff that he worked with. So I tried to carry that over into my practice, and that's why we came up with the three things that we believe in Prime Surgicare, which is quality, in terms of the quality of care that we give our patients. We always want to make sure that that is top notch. Then care, in terms of seeing the patient as an individual, who could be your own relative, who could be your own sister or brother, getting to know them beyond what medical problems that they have, and really, empathizing and seeing them as a human being, as a friend, and as someone who, should be really cared for. And the third thing is trust. We just want to build trust with our patients, because for someone to put their life in your hands, I believe that is a real big responsibility, and we don't take it lightly. We want our patients to really trust us, that we are going to do our best, that we care for them. So always try to build trust, and that's why we explain the procedures that we do in very simple terms that people can understand, so that they are invested in the medical care that we're giving to them. So the most gratifying thing for me is when patients give me feedback and tell me that they appreciate the care that they've received, that they felt like they were treated like, you know, individuals, like persons, that they didn't feel like they were just a case being pushed along. And if they feel like they know me on a personal level and that they can relate to me and they can open up and talk about things not even related to their particular medical condition, you know, if they see me as a friend, I think I've achieved my goal.